the learning objective of this video are first is the definition of self-directed learning. What is self-directed learning? What are the purpose of self-directed learning? Principles of self-directed learning, educational theories of SDL, stages of SDL, and how SDL is important now in the medical curriculum, and how to implement SDL, and how to assess and evaluate the self-directed learning, digital tools. These are the topics we are going to cover in this video. Now, what is SDL? The most popular and accepted definition of SDL or self-directed learning is given by Malcolm Knowles in the year of 1975. So this is Malcolm Knowles, and this is his book. So that definition says self-directed learning is a process in which individuals take initiative with or without help of others in diagnosing their own learning needs, formulating goals, identifying human and material resources for learning, choosing and implementing appropriate learning strategies, and evaluating learning outcomes. So this is the definition of self-directed learning. From that definition, Knowles identified 5 cognitive activities that need to be undertaken when following in SDL process. And Sargent et al., they added another element to it. So what are those 5 cognitive activities? First is diagnose one's own learning need. Second is that formulation of goals. So if I know why I want to learn this, then I will formulate my goals. Then there will be identification of resources for learning. And number 4 is choose and implement appropriate learning strategies. And the 5th point is, that is the evaluation of learning outcomes. And the Sargent et al., they have added the 6th component, which is the willingness to drive one's own learning. So if I know why I am going to learn it, so all these things automatically comes, and that comprises an ideal self-directed learning. So we can take it or explain it by some example. So one of the adult learning is learning driving. Okay. So when we feel need of that I need a car, I have to reach my destination early, and I have to drive by myself. So when I feel the need for it, suppose, then I will actually formulate my goal. Okay, so within this period of time, I will learn the driving. So for that, I will identify the resources for the learning. So I will go to the driving school. I will take the lessons. Okay, and I will also choose and implement learning strategies. So how I am going to learn it? By reading, by memorizing this, by skill learning method, I will learn the driving. So I will choose and implement appropriate learning strategies. And after that, I know that I have to apply for a driving test. I have to appear for an evaluation of my learning outcomes, and I will get the result, that is my license. So the willingness of myself, it will also enhance the process of learning. So all of this, it is included in this self-directed learning. So first, in the previous slide, I have told you that diagnosing own learning need is the first point. Then formulating goals is the second point. Third point that is mentioned by the Malcolm Knowles is the identifying resources for learning. Fourth point is choose and implement appropriate learning strategies. Fifth point is the evaluation of learning outcomes and the willingness of to drive one's own learning. So we know the definition of SDL, self-directed learning. We know what is SDL, and now come to the point, why do we need the SDL, especially in medical education. The first point is the vast curriculum taught by a variety of teaching learning methods and variety of teachers as well. So medical curriculum, it is very vast. Different teachers, their teaching learning method is different. Different methods of teaching learning we also do with some bedside clinics. We do lecture class, didactic lectures. We do some small group discussions, hands-on practical demonstration. So for these, the self-directed learning is important because to cover all these things in one's own pace. Now the second point is different learning styles and pace of different students. We know some students are visual learner, some students are auditory learner, some are kinesthetic learners. So in a single class, in a single didactic lectures or small group discussion, we cannot address all type of students. So in these cases, SDL allows the students to learn at their own pace and with their own learning style. Another important cause why we need SDL is that in medical colleges we can see that there is shrinking number of faculties. Day by day the number of students are gradually increasing and the number of faculties, it is gradually decreasing. So these self-directed learning, it enables students to take responsibility of a part of their own learning or syllabus. Now the fourth point is difficulty in understanding relevance of varied subjects and memorization. So that means, so suppose a student is learning liver anatomy in anatomy class, and the mechanism of jaundice and how the bile is formed, what are the different types of jaundice, the clinical aspect in physiology class, and the liver function test in the biochemistry. Okay, so if these all things, they are not correlated, or if there is no integration among them, then it becomes difficult for the student to understand the relevance, and also it becomes difficult for them to memorize. So SDL or self-directed learning, if the student learns the jaundice here and then by self-directed learning he learns how to diagnose it. Okay, so it is known to improve a student's ability to cross-link learning context and improve retention. That is most important, and also application of knowledge on their own. And suppose after learning all these things, even in after integrated class, he learned the palpation of liver. Okay, so by himself, by some methods, by this self-directed learning, or how to diagnose a specific case of obstructive jaundice. Okay, so in that case, the student is self-motivated, and he could relate the context of the topic, and it helps in the memorization of that topic and also application of the knowledge when we will clinical practice. So fifth point is that addressing adult learners. So SDL treats medical students as mature adult learners. We know that. What are the components of adult learning? Because it is a need-based learning, it is an experience-based learning. So the student will develop or build up the knowledge from the previous experience. The student is intrinsically motivated, and he will formulate his own goal and the learning strategies, and ultimately also undergo the evaluation. So this adult learning approach, it helps to improve the learning process. So SDL addresses these adult learners. Now the sixth point is the need for globalization of medical education. Global learners are being given similar experiences and opportunities to learn. Suppose I want to learn about the systematic review or meta-analysis. So I have enrolled in a course of the Stanford University, an online course. So I will learn the same thing as taught by the Stanford University teacher. So I am a global learner now. I can have a similar experience as the Stanford University student. So this is a globalization of medical education. It is needed nowadays. The seventh cause is the advent of online learning at virtual universities. Now, the recent pandemic had made us experience online courses, and maybe virtual universities too can be a possibility in new normal after pandemic. So after pandemic, especially this self-directed learning has become more eminent in our day-to-day learning practice. Another cause why do we need SDL is the cost of higher education. So e-learning now is an excellent example of SDL, that is cost effective solution to higher education in certain areas of medical education. Now the purpose of SDL. The most important purpose of SDL is to create lifelong learning skills among the students. It is very important, especially in case of medical education, because medicine is a dynamic subject. It is changing. So throughout our lifetime, we have to update ourselves, not only to update, but also implement that changed knowledge in our workplace. So to create a lifelong learner is one of the most important purposes of SDL. Now the purpose of SDL or concept of SDL is rooted in few skills. First is the critical thinking skill, then the self-management skill, social skill, communication skill, analytical skill, and the research skill. Okay, so first is your critical thinking skill. What do we mean by the critical thinking? It is actually the ability to question, to test which is previously held as assumptions, which is previously it is known, we take it as a convention. So it is the ability, critical thinking skill is the ability to question or test what is previously held assumptions. And it is the ability to recognize the ambiguity of already known facts, then to examine and not only to question the ambiguity, but also to examine, interpret, evaluate, reason, and reflect, so that one can make an informed judgment and decisions on these changes. So okay, so this is a critical thinking skill, and there are 5 characteristics of this skill. One is the open-mindedness and respecting the evidence and reasoning. So anything that is proved by evidence or reason, that will gain your respect. You will give the maximum value to it. Now the third characteristic of critical thinking person is being able to consider different perspectives and points of view, or having cognitive flexibility. And another characteristic is the clarity and the precision. So SDL or self-directed learning helps to develop this critical thinking skill. Now the second point is the self-management skills. It is the ability to regulate one's emotion, thoughts and behaviors effectively in different situations. Okay, so how these self-management skills it can be done? It can be done by self-awareness. That is, I will embrace my strength. I will adapt to challenges. I will set goals to myself. I will understand my emotions. I will be patient and prioritize my well-being. So all these, that is self-awareness, self-confidence, self-control, and self-evaluation, all is included in this self-management skill. So SDL is also rooted into this self-management skill. When I am going to learn something by myself, so this self-management skill, it automatically comes within me. And the third point is the social skill. So what is a social skill? Social skill is that how actually we use we interact or communicate with the others. So with this skill, we actually communicate with others. It may be the verbal communications or non-verbal communication. So that we will come to the communication skill also. So SDL also improves this communication skill. So there are different modes of communication skill. These skills actually allow us to understand and to be understood by others. Okay, so there will be different types of communications: written communication, verbal or non-verbal communication, presentations, listening, cross-cultural communications, all these. So if we look at the verbal communication skill, so that means improved or good verbal communication skill means speaking clearly and concisely, listening actively, that is important, and giving and receiving feedback. Now come to the analytical skill. It is the ability to deconstruct information into smaller categories in order to draw conclusions. So we know that there will be collection of data, analyzing problem, choosing the right path. So all will be included into these analytical skills and analytical thinking. So SDL also helps to improve these analytical skills and analytical thinking, as well as it also improves the research skill. Another important purpose of SDL is the developing the metacognition. So what is metacognition? It is an unconscious awareness of one's cognition and it is an important prerequisite for a medical student. It includes a procedural, declarative and conditional knowledge. And what actually this metacognition is, it is thinking about your thinking. Okay, so there is a difference between the cognition and the metacognition. Cognition is just a thinking skill, such as the skill we develop to store or remember or retrieve or recall the information in our minds. Whereas metacognition is the ability to control our own cognition. For example, the capacity to reflect on what cognition skill we use to succeed in a given task. So implementation, by using that memory, how can I solve a problem or I can succeed in a given task, that is the metacognition. Now this metacognition is also improved by the self-directed learning. Now self-directed learning also gives us an autonomy to the student. Okay, so student can choose which topic he or she wants to learn by himself or herself, and it also gives a kind of self-confidence to the student. So if you are a motivated student and if you know your purpose, so you can set your goal like this, and you can arrange different methods to reach that goal. So what are those methods? You will be independently find resources. You will connect the newer concept with your previous knowledge. You will monitor your comprehension. You will inquire about things that you do not understand. You synthesize what you have learned, and you will apply that learning in a practical context. So if you do these things by yourself, then you are a successful self-directed learner, and the concept of SDL, it is clear to you now. And if all these processes, that is identifying goal, then objective formation, then learning strategies formation, evaluation, it is done by you, so you are a successful self-directed learner. Who are you? So you know where you actually understand your needs, then you know where actually you stand, and to what direction, to what end point you need to go. So what is the distance between your finishing line and your present position? How can you reduce this difference? And you will become, in this process of learning, you will become self-disciplined, will be organized, you will be self-controlled, self-motivated, and when the thing is learned, you will communicate this skill, you will implement this skill at your own workplace. So this is the purpose of SDL, to make you a successful learner who is very confident, who has self-control, who has belief in himself, and there will be improved metacognition. Till now, we have completed the definition of SDL. We know what is SDL, and we know what are the purposes of SDL, what are the principles of SDL. Now we are going to move to the educational theories related to SDL. There are three educational theories for self-directed learning. One is cognitivism theory. Here, this theory says a learner uses his memory and understanding to develop tools for self-directed learning. The second one is a humanism theory. A learner becomes self-directed with the experiences while becoming a doctor and a human being. And the third one is a constructivism theory. It is also known as the experiential theory. Here, a learner uses experience and internal processing to construct concepts. Now, what is this cognitivism theory? It actually says that it is a cognitive learning theory pertains to learning from the processes in the mind, that is mental and psychological. That we know that when we learn something, there will be short-term and long-term memory. So it involves the perceptions, processing of information, and memory in the learning process. And it focuses on the point that the student should learn how to learn. And the next thing is the experiential learning that we are going to see in the next slide. Experiential learning occurs when the students reflect on the experience. Now, experiential learning is based on the Kolb's learning cycle. So, this is David A. Kolb. He, in the year 1984, has given a theory of the self-directed learning. So, that according to that theory, it says that the cognitive learning cycle, it involves 4 stages. So first stage is the concrete learning. Here the first stage is the concrete learning. Here actually the learner encounters a new experience or reinterprets an existing experience. For example, in case of in faculty development program, we say about the lecture class, didactic lecture, how can we make it more interactive. So the concrete learning is a phase, it is a first phase or first stage where the learner, the faculty will encounter a new experience. He or she will hear some new things to how to make the didactic lecture more interactive. So this stage is the first stage. It will be followed by the second stage. The second stage is known as the reflective observation. This is known as the reflective observation. Here, the learner reflects on the experience on a personal basis. The learner or the faculty already takes lecture class. Now he reflects that I take in this way, and this is taught that how can I make it more interactive. So he will actually compare or reflect on his own experience at a personal basis. So this is known as the reflective observation. Now the third stage is the abstract conceptualization. Here actually the learner forms new ideas or modifies the existing abstract ideas based on the reflections arising from this previous reflective observation stage. So in these abstract conceptualization, the learner actually plans or forms new ideas that they have given us so many more to make the didactic lecture interactive. So among them, these I can use in my own working place to make my lecture more interactive. So this is the abstract conceptualization where the learner forms new ideas. Now the fourth stage, it is the active experimentation. That means when after planning or after having this new idea, when the faculty will implement that idea in the workplace, so that is the active experimentation. Here the learner applies the new ideas to see if anything changes or not. Now after doing this stage 4 or active experimentation, then the learning process becomes a concrete learning experience. So this is the Kolb's learning cycle of experiential learning. So this is one of the educational theory. One is the cognitivism theory, one is the humanitism theory, another is the experiential theory, which we can explain by this Kolb's learning cycle. Now, what are the stages of self-directed learning? Gerald Groves staged self-directed learning or SSDL. That SSDL model proposes that learner advance through stages of increasing self-direction and that teachers can help or hinder that development. So, what are the stages from the dependent learner? Ultimately, the learner will become a self-directed learner. So, this is the SSDL model. So, who is this? The stage number 1 is a dependent learner. Who is this dependent learner? Dependent learner, they need explicit instructions from the teacher. Then the stage number 2 is the interested learner. Actually, here the student is interested in a moldable and it is like a moldable clay. And the third stage is the involved learner and fourth stage is the self-directed learner. Now we will see all these different types of learner one by one. So stage 1 is the dependent learner. Dependent learner, in case of dependent learner, teacher is the authority or coach. So student is totally dependent on teacher and they need explicit instructions on what to do, how to do, when to do something. So they prefer teachers who are credible authorities or coaches who will make them learn. So learner relies on teacher, and what is the role of the teacher? It is everything. Organizing content clearly, taking formal lectures, structured tutorials, talk about the mistake, modeling and demonstration, notice whether the learners are understanding or not, paying attention or not, gradually move learners away from dependency by involving them in designing and content learning. Okay, and teacher also provide feedback. So this is the stage number 1, dependent learner. Then the stage number 2, that is the interested learner. So in case of interested learner, the learner is a moldable clay. Approachable teachers with a charismatic personality work well with these learners. Because learners will respond well to personal interaction. The first part of the interaction involves explaining the concept and next part involves getting the learner to express their own understanding and exhibit their learning. Okay, so here actually the student seeks some opportunities and sets some goals. So some amount of teaching learning method, the teaching will be directive, but along with it, it will be also supportive. And the strategies such as lecture followed by demonstration or discussion or assignment given after an introduction to the topic work here. And the teacher-led discussions and it will act very good for these students, and teacher will play as the role of a motivator. That is the reason why the charismatic personality it actually work well with these learners. And teacher gives motivational lectures, guided discussions, learning settings, how to set the goal, all these instructions. So this is the stage number 2, that is the interested learner. Now the third stage is the involved learner. The student is an involved learner with his or her own experiences. Now teachers and students here, they share the same platform of decision making. And with students, increasingly they take over the role of the teacher. So teacher here acts as a facilitator. So what is the role of teacher? Teacher makes learner conscious of learning strategies, tools and techniques, and there will be student-led discussions, and the teacher will be facilitator. Teacher will listen to them, draw them to share their ideas and experience, and teacher works with the learner as an equal, stepping in and out of the group when required. So there will be an open-ended scenario that encourages the student. And so here the teacher is a facilitator in case of the involved learner. Now the fourth stage of learner is the ultimate end stage is the self-directed learner. In case of this self-directed learner, learner is intrinsically motivated, and students take the responsibility of directions of their learning. They set their own goals. They are able to monitor and assess their own performance with or without the presence of teacher. And they have metacognitive and self-regulative ability as well as time management and project management skills. So what happens here? What is the role of the teacher here? Teacher acts as a consultant, and the relationship between the students and the task it takes the precedence rather than the teacher-student relationship. Teachers need to be available, obviously, to suggest changes, to supervise, to monitor the progress, but essentially they empower the learner to be independent. So these are the 4 stages of self-directed learning learners. Now what can be the mode of teaching in all these 4 stages? In the stage 1 or dependent learner, the didactic lecture, it is a dependent students, and assessment can be the formative assessment, summarizing and questioning to check for answering, ask students to reflect on learning, and give feedback. Timely and constructive feedback should be given to the student, and the success should be rewarded. That will uplift the self-esteem of the student. Then stage number 2, here the student is the interested learner. Here you can have the interactive lecture, and assessment can be providing feedback, gradually phase out the intrinsic motivations and maintain records of students' progress. Okay, so this is a stage 2. Stage 3 is the involved learner. Here the teaching learning method can be small group discussion, and the assessment can be open-ended assignments which require them to apply their knowledge and create something new. For example, designing a plan for a poster presentation, designing a plan to show different gait disorders of different clinical diseases. So these are the methods by which you can assess and the students. Now stage number 4 is a self-directed learner. Here the mode of teaching could be a seminar, and the assessment means provide broad templates of what is expected as the final assessment product, and dissertation and internships and other examples of independent work. So these would be the mode of assessment strategies. Now, why we are so much talking about this self-directed learning in medical education? Because in 2019, when the CBME was published by the NMC, so it shows that in each and every subjects of each and every phase, a specific hours was distributed. Hours were distributed by NMC where this self-directed learning has to be implemented. So this is the routine for pathomicro, community medicine, forensic medicine, that is the phase 2. This is a routine for phase 1, anatomy, physiology and biochemistry. We could see here that 30 hours it has been allotted to take this SDL. So NMC is asking us to give more importance on this self-directed learning, and already some hours are given to each subjects to do this SDL. So for this, we faculties, we need to have a clear concept of SDL, and we need to know how we are going to implement it in our setup. Moreover, we know that what are the 5 roles of IMG that we know: the clinician, leader, communicator, lifelong learner and professional. So lifelong learner means, so if you want to become a lifelong learner, so this self-directed learning method, it is very helpful. And indirectly all these clinicians, because if you are a lifelong learner, so you will be a good clinician because you will update your knowledge and you will implement it in your clinical practice. Leader, communicator, professional, everything will ultimately indirectly related to this SDL and the lifelong learner. So that's why we are giving very high emphasis on this self-directed learning. Moreover, if we look at the competencies of the lifelong learner as mentioned by NMC, we'll see that all the aspects of SDL that we are talking about, it has been covered here. So lifelong learner committed to continuous improvement of skills and knowledge. He has the demonstrate ability. He will demonstrate ability to perform an objective self-assessment of knowledge, skills, continue learning, refine existing skills and acquire new skills. He will demonstrate ability to apply newly gained knowledge. So application of newly gained knowledge or skills to the care of the patient, this is needed. Demonstrate ability to introspect and utilize experiences. We have learned about experiential learnings. What are the different stages of this experiential learning? First is the experience, then the reflection, then abstract conceptualization, then the implementation itself or active experimentation. So demonstrate ability to introspect and utilize experiences to enhance personal and professional growth and learning. Demonstrate ability to search, including through the electronic means, and critically evaluate. So critical analysis, how to question what is already present. So how to question it, how to see the ambiguity, how to solve that question. So this is also we will perform in the SDL. It is a principle of SDL also, and will be able to identify and select an appropriate career pathway that is professionally rewarding and personally fulfilling. So lifelong learners should have all these competencies, and all of them will be practiced if we practice the SDL in our curriculum. So now the digital tools for the SDL learners. So this is the digital era, and this is the era of networking. So resource the sharing online, monitoring online library visits, hits on websites, using online tools in debriefing, and using digital tools for assessments, all will be helpful for the SDL. Now, what is the role of teacher in the self-directed learning? The concept should change from that of teacher to that of facilitator here. Teacher will act as a motivator, designer of the learning situation, and the teacher will join the student as a continuing co-learner. Now, there are some myths about SDL, that the teacher has no role to play in SDL. The term self-directed learning does not imply that there is no need for a teacher. Let us recall Knowles, the definition here, where he clearly talked about learning with or without help from others. One of the key skills of self-directed learner is to know when to seek help or support. A learner may choose to learn on his own or with the help of others, or to learn with others. It is the student's or learner's prerogative to ask for help if required. Now, when a learner seeks help, a teacher must be accessible or available to help. Teacher's role is that of a facilitator of learning rather than a dispenser of content. Teacher will ensure that the learner does not deviate from the intended learning objectives. Okay, so teacher must purposefully move the onus of learning from teacher as model to joint responsibility of teacher learner. Now it is quite like teaching a child to ride a bicycle, where you gradually run alongside, steady the child when the bike wobbles, and eventually allow her to ride independently minus any scaffolds. Our task as teacher will be to gradually nudge students to shift their locus of control internally, so that they enjoy the learning process and move towards deep learning, rather than become exam oriented rote learners who are satisfied by superficial learning. So the self-directed learning, we know that, we already know it is in our system. So first it is a dependent learner. We are teaching bicycling. So here the teacher is the authoritarian teacher, and gradually you will remove the hand, and you will shift the responsibility from teacher to on the learner, and the learner will learn by experiences. So this is experiential learning, and ultimately the learner will become a self-directed learner, independent learner, and he will independently carry forward all things. So it is the conversion from an exam oriented rote learner who are satisfied by superficial learning to an independent learner who will enjoy the learning process and move towards the deeper learning. Now we have covered the definition of SDL, what is SDL, what is the purpose of SDL, principles of SDL, what are the educational theories, stages of SDL. Now what is the role of SDL in our present curriculum, what are the digital tools we can use for it, and now we will focus on how we will implement the self-directed learning in our setup. What should be our preparation, what are the venues as a teacher, what are the roles that we need to play. Now how to conduct SDL. So first is the preparation, the faculty training and formation of core committee, selection of topics, that is very important. What are the topics you are going to select for self-directed learning? You can take the opinion from the students as well. Placement in curriculum, and you have to meet it in the curriculum plan, and orientation of the students of the SDL program. So students should be elaborately described about how they are going to study, how they are going to do this thing, and gathering resources necessary for starting SDL program like venues, timetable adjustments, computer with Wi-Fi connections, IT personnel if needed, formation of online group of the students and faculty, distributing pre-session logistic materials to the students. So suppose if I want to have a project based learning on say action potential of nerve fiber. So previously I have to give the handouts on this topic, or the iron deficiency anemia, or the thalassemia. So I have to give the beforehand some the logistic materials and the handouts so the students could study. I will explain the student how they are going to make this project, how they are going to present say a case of thalassemia, or how they present a poster on the action potential of the nerve fiber. So in this way the prior preparation is needed. So here we could see that ideally there will be two sessions. First session, say it is a Monday. On a Monday, we have 60 minutes session on for the first 10 minutes the instruction to the small group members. What are the groups and who will study together? So the group distribution that will be done on the first 10 minutes, followed by the 20 minutes the setting the learning goals. What are the things that group will learn? The definition of anemia or the thalassemia, what are the clinical features, how they will investigate, and how will they will, all these things, that goals should be set. And the next 30 minutes there will be the facilitator will help planning the finding resource material, and the group will disassemble. Okay, so the facilitator will suggest, so you can see these book, these are the online sites you can consult and consult where this in the ward this thalassemia baby has been admitted for blood transfusion, you can see that patient. So in this way you can guide. So 10 plus 20 plus 30. So that is the first session, session number 1. Then there will be a gap period of 7 days. In this 1 or 2 weeks ideally. So in the next Monday or next to next Monday, so student will do another session of 60 minutes. In between, in these 1 to 2 weeks, student will find the resources, they will read resources, they will contact the facilitator for guidance. Okay, and the facilitator will guide them whenever the student will seek the help. Now in the session 2, in the next Monday or the next to next Monday, there will be another 60-minute session. So first is a 30 minute, they will present the poster, you will assess them, then you can debrief their learning opportunities, their experiences. So it is the session number 2. So ideally the SDL should be done in these 2 sessions, session 1 followed by a gap of 1 to 2 weeks, then there will be another session number 2, and the teacher will be in continuous in touch with the student in this intervening period while they are preparing their study. One such study we have done at our institution, Rampurhar Government Medical College, where the project was the poster making on the action potential of nerve fiber. So we have divided into different groups. So initial in the session 1, what we did, we gave a 60 minutes lectures on how they will perform this activity. So this is done. Now after 7 days they have presented the poster and we have evaluated them. So in this way the 60 minute session in the day 1 followed by a gap of 1 or 2 weeks, then the session 2 evaluation. It is the ideal way of doing SDL. Now what can be the venues for SDL? It can be anywhere in case of formal teaching of problem based learning or the case based learning. So it may be the lecture class, demonstration room, or the e-learning methods can also be used. It may be the bedside teaching. So in any types of teaching learning areas, they can be utilized as the venue for the SDL. In case of e-learning, you can use the library with the computers where they can find their resource material. So anything where the facilitator and the students feel comfortable and can be used as the venue. Now one important point is that this gap, So suppose this is on the introduction one, it is done on this topic on, say here it is in the block 1 on the medicine on this day. There is a gap of it, then there will be a presentation. So this intervening period is actually the actual or real self-directed learning period. Here the teacher will act as a facilitator, and in this period also, so you can make a WhatsApp group, so you can monitor their conversation, how they are making the projects, what are the resource materials they are sharing. So you can have a track on that also. You can have the track of their attendance, their participation and willingness also by this. So before you make the actual implementation of SDL, have a lesson plan. Just like your lecture class, you must have a lesson plan. This is an example of lesson plan. So here actually it is the third Prof MBBS part 1 and the coordinator's name. So you can make a chart like this. What are the coordinator's name? What is the facilitator's name? What is the topic? Here the topic is, it is from the ophthalmology. So it is a glaucoma. So what are the competencies addressed? So here actually they have mentioned the competency. Enumerate and discuss the etiology, the clinical distinguishing features of shallow and deep anterior chamber. Choose appropriate investigations for patients with above conditions and their of the anterior chamber. And enumerate, describe the causes of blindness and national program to control blindness. So these are the learning objectives. So they have divided, so this is a competency, they have divided them into the learning objectives, and domain addressed is the cognitive domain, the affective domain. Okay, so explore the magnitude of glaucoma in the community, describe the social aspects, then explain the role of PHC and the CHC in identifying the treating glaucoma, develop material to create awareness on glaucoma in the community. So these are the learning objectives they have decided. Now they have, in the session 1, they had depicted the goal. Okay, so what are the things? First is the introduction, then setting the goal. Now what are the topics and resource materials, and method is the introductory session in glaucoma, and then brainstorming and PPT or the discussion. So attendance is taken. So in this way you can also plan a session 1. Then session 2, they have given 1 week time, group discussion, then interview. So all these things, and you can take the attendance, online attendance also. Now the ultimate session, the next session after 1 week, where they have presented a case, they have evaluated. Okay, so in this way you can plan a session. In our study, in case of first year MBBS students, actually we have done the, in case of diabetes mellitus, so the competency addressed are those which already mentioned. We have divided them into some learning objectives, and then we have made in the session 1, we said the goal, and we have described it, the diabetes mellitus clinical features. In the 1 week they have seen, we have given the resource material, they have seen the patients, their bedside tickets, their investigations, their drugs, everything. Then they will present a case, or they will describe a poster on the clinical features of diabetes, what are the physiological basis of the pathophysiology, and all the can, if can give the explanation of using certain hypoglycemic drugs like this, and we will assess on the basis of their MCQ, SAQ, or Viva, or like this. Okay, so and we will give the feedback to the student. So in this way you should have a lesson plan prior you implement the actual process of SDL. Now the assessment of and the evaluation of SDL is very important. Assessment and evaluation can be done by various methods, by the grading of the project work, by OSPE, tutorial, MCQs, reflections and feedback, and it can also be done by the log books or multi-source feedbacks and the portfolios. Okay, so in next few slides we will discuss about the process of assessment and what are the challenges we will face during the time of assessment. So how we are going to assess or evaluate the self-directed learning. The session 1 is done, the project is given. We have given a gap of 1 or 2 weeks. Now the students are ready with their project. How we are going to assess them. So that is, so while assessing, we have to think about two things. One is the content outcome and another is the process outcome. So what is content outcome and what is process outcome, that we need to know. So content outcome is actually the outcome of the knowledge. So content learning outcome, as it is the outcome that is in terms of knowledge. So the learning achievement of the students in understanding and applying the course content will be observed through the scores of exams, paper assignments and discussions. So you can take exam of the students to know how much knowledge gain has been done by the student. Now the content outcome, that is the knowledge gain, it can be assessed, the individual assessment that each of my students how much knowledge gain is there, and the group assessment. When they are presenting the project as a group, you can assess their performance as a group. So individual assessment of the student, that can be done by MCQ or any mode of test that you want to take. So you give the questions and you give the scoring and you can see how much score they have gained. So you can understand the knowledge gain of the student. If you take a pre-test and then take this test, so you can compare their knowledge gain also. Now how can we take the group assessment? Now the group assessment can be done by such facilitator score sheet you can see here. So you can write down the name of the facilitator. If I am doing the assessment, you can write down my name and then name of the group. If I have divided the 50 students into 5 groups, then group A, and I will judge their poster like this on these criteria. It may be up to you according to the facilitator. It has been judged by these criteria, that is the clarity of the poster, innovativeness of the poster, any research update is there, application, presentation, crossing, how much they have been doing well, and the overall impression. So you can give them grades or marks according to these 5 scales or whatever scale that you want. Okay, so the group 1 assessment of knowledge is the individual knowledge that is tested by MCQ or by other methods, and the group performance, you can note down their performance according to a grade on the facilitator's score sheet like this. So the content outcome of the individual and the content outcome of the group can be assessed in this way. The next thing is the process outcome. Process means while making the poster, what are the process they have followed or not. So that is a process outcome. So process outcome means whether the group dynamics of this what it is followed or not. Did the student show team spirit during conflict of opinion? Did the student contribute actively? All the students contribute actively during presentation. Time management. Did the group leader help to bring out the new ideas? Was there adequate willingness by all group members? Because many a times many students complain that I have made the done the whole work, all other students they were not willing to do it. So process outcome is important. So you can, while they are presenting, so you can see them. So just like the content outcome, process outcome can also be measured as a group process outcome and the individual process outcome. Now all the points mentioned in the previous slides, that is whether the group dynamics followed or not, whether the willingness of the participant were there or not. You can assess them while they are presenting by seeing their body language, by seeing their presentation, is all the participants are involved in the presentation or not. So that is the group assessment of the process outcome. Now it is difficult to assess the individual process outcome. Okay, suppose a group contains 5 students. So each of them during the process of making of the project, how was their participation, how was their willingness? It is a bit difficult for the facilitator to understand at the time of presentation. So how can we solve this problem? We can solve this problem by some peer assessment score sheet. In that group, you have to distribute this score sheet. So peers will give marks on the other members, and it should be very confidential. So marks will be given like this. Member 1 completed the assigned task on time, quality of the work, quantity of the work done by that member, was that member was an active member of the group and participated in the activity wholeheartedly, listened to the other group members and offered input openly, avoided self-centered roles or followed agendas, and contributed to the group's maintenance functions. So these are the points on which you ask the peers to assess the other members. And what happens, often the peers they fear to give honest assessment about their other members, um, to have a bad relationship or some other personal problems or like that. So you can take a pledge like this, that if you have worked with other students in this project, please rate your team members on this and on this 5-point scale. Okay, and this rating is confidential and anonymous. Be honest on this evaluation. You can take the pledge like this. And even if you take the pledge, students often do not give the honest feedback, because some of them they are very good friends, some of them they are enemies. So this personal relationship may affect their scoring. So you can overcome in this way, that you can reshuffle the roll number. It is seen that in case of 100 one of 50 students, roll number 1 has less good communications with 150. So you have to reshuffle the students or mix them in such a way that they have less interpersonal relationships or like this. And in the and other ways, you have to train the student. Okay, so you have to ensure the confidentiality, and you have to assure them that this score will not affect their performance in the future results. Okay, so how can you train them? So you can have a trigger session during the time of presentation, that is the session 1, 10 minutes, 20 minutes, and another 30 minutes in this way. So when you have given the instructions for the SDL, you can be very clear about the peer assessment process, and you should be very clear on the expectation from the students. Ensure it can be assessed by a peer of same level. Make the statements, you ask them to make the statement brief, clear and unambiguous. Check for the language and grammar, and do pilot test and validate before give your questionnaires to the students. So individual, so this is a paper we have published, implementing the peer assessment. So it is available in the net. So you can take the reference of this paper. Now another way of, so one way is by assess the student or evaluate the student by taking the content outcome of the group and individual, that is individual by MCQ and by the facilitator score sheet, the presentation. And then the process outcome, one is again, and the group you can take the performance and note down the score in the facilitator score sheet. Another, the process outcome of the individual students you can assess by the peer assessment score sheet. Another way of assessing or evaluating the SDL, it is by reflection. Okay, so we do not learn from experience, we learn from reflecting on the experience. It is a well-known fact. So what is reflection actually? So what is reflection? So according to Rolfe et al. 2001, so reflection is based on three things. What happened? So actually the student will describe the experience of doing this project. So first he will write what happened, describe the event, then so what, identify the implications of that event, and now what is the define a course of action. So I have get this experience, this means this to me, and from the next my future actions will be influenced in this way by this experience. So this is a reflection writing way. So here we could see reflection writing by a trainee nurse. Okay, so she has written in this way. A child was presented by her mother to have a standard scheduled vaccination. The female child, aged 3, was upset and appeared to be scared of the needle and did not want to have the injection. So the trainee nurse is experiencing how to give a vaccination to a child of 3-year-old. The mother wanted to get it done but was also upset at seeing her child distressed. I was asked by the junior doctor giving the shot to try and distract the child while he prepared and gave her the injections. I did not know what to do. I first tried to talk to the child to distract her, which did not work. The mother said to me, "Peekaboo." I then played peekaboo, pretending to hide behind my hands, and the girl was distracted, and the doctor rapidly gave her the injection, which she hardly noticed. So this is actually the experience. What is experience? So the next point is, so what? So what means that the things that I did not know, the trainee nurse already explained, I did not know how to distract the child. So what is that? This is the part that I did not know. So what next will be, so from the next time when I will try to give vaccination to a child, so I will distract by doing peekaboo. So these are the three things. First is my experience, then the implications of this experience, and the third thing is that when I will do this act next time, what are the corrections I will do. So this is a reflection writing. Now if students have written a reflection like this, they have what their experience while doing the project work, then what are the things they have learned. So when they will do the next project, what are the things they will not do, that what are the things they will do. So how you are going to grade it. There are so many approach. According to Moon 2004, you can grade by grade A, B, C. Grade A is experiencing an event has changed or confirmed. So all the points are there. That is what happened, then so what and what next. If everything is mentioned, how you experience an event, you may wish to change how to respond to similar event in future. So you will give the student grade A. Grade B involves judgment, what went well or less well and why. Okay, but in future, what are the things that I will do, that is not mentioned. In the grade A, also the reference to other literature, articles or books, if it is mentioned, then it is much more good. So grade C is describing an event, recognizing how it affects your feelings, attitude or beliefs, or questioning what has been learned and comparing with to the previous experience. Now, grade D, describing an event, recognizing that something important has happened, but not explaining why it was important. Grade E is describing an event, repeating the details of an event without offering any interpretation. And grade F is description of an event in a very poor way, so poor description. So in this way, Moon has assessed the reflection. Another way of reflection assessment is the Halton and Smith method. where these points have to be mentioned and you can grade them. What do I do? What does this mean? And how did I come to do they like this? How might I do things differently? So, and you can grade it also by Ash and Clayton method, who mentioned it in 2009. That is also known as the deal method. So, if the reflection writing contains D means the describe the experience, E means the examine the experience through the lens of academic concepts or strategies, AL means articulate learning by explaining what you learned, how you learned it, and why it's important. So this is the Ash and Clayton method of grading the reflection. Now come to the challenges to implement the SDL. So you are trying to you are a new enthusiastic teacher. You have learned so many things about the SDL, so many educational theories you have learned, so many stages of learner you have learned. You have seen that how it has to be implemented. So you are now very enthusiastic. Now what are the barriers that are going to obstruct and cause the failure of your project? So these hindrances can be classified into three headings. The hindrances coming from the students, hindrances coming from the facilitators, and hindrances coming from the administration. We will have a detailed video on this only on the challenges to implement SDL. Here we are covering this topic in short. First is the challenges that is coming from the students, their cognitive and mental barriers, information overload, lack of focus on learning, mind wandering. The paper that we have published from our institute in a project based learning, it has shown that the high scoring group or the so-called good students, they showed very poor performance in the process outcome. Their individual knowledge gain was very high, but during as a group member, their process outcome was very poor. So when they were inquired about it, they told that this project things they found it a wastage of time. So this is a mental barrier, and communication barrier is also there, role of uncertainty, and the educational and environmental barriers, heavy workload and inadequate coping skills, and also lack of motivation, active participation of all students. They do not write the proper feedback. So all these are the challenges that come from the students. Now regarding the facilitators, most important is the limitation or the shortage of faculties. Second is the motivation of the faculties. Training of facilitators, it is inadequate. They do not know what is SDL, how to implement it, availability of resources, and providing individual feedback to a large class. Okay, because we have 200 or 250 students, so if we need to give individual feedback to all of them for each and every project, it becomes very difficult. So the third challenge, that is the administrative challenge, that is allotting time in a short and fast paced course, because within a very short time we have to cover all the things. So how many topics we will use for SDL, how much time can we allot for it, and first the choosing of topic is also important thing. Designing SDL activities relevant to the course content, assigning significant weight to the SDL grade, physical environment, the classroom and LCD projectors, their availability, conveying the concept and importance of SDL to the other facilitator, to the students, that is also important, to the administrators also, and development of assessment rubric, how we are going to assess. That is the score sheet on which points it has to be validated. So this is also important. It can act as a barrier. These are the suggested readings from different sources. And acknowledgement to the medical education unit of Rampur GNC. Thank you.